Hi dear friends, welcome back. We will be discussing today time in relation to evolution and management coding in the medical field. In our ongoing series on evolution and management service, be sure to be subscribed and turn on notification for updates on new episode, including E&M coding tips when calculating time for E&M service. It is important to note that every second counts toward the time component. Only certain activities are considered, such as medical decision making. Additionally, the time must be on the date of the encounter. If a provider reviews tests 2 days later, that time does not count towards the coding based on the time. In regards to hospital admission, if patient is admitted before midnight and seen by the provider after midnight, the service should be billed as a single service on the date the encounter began according to Medicare guidelines. So, what elements can be count towards the count for the E&M services? Some example includes medical decision making and other specific activities. So here, preparing to see the patient, obtaining or reviewing separately, obtaining history, performing medically appropriate exam or evolution, counseling and education the patient, family or caregiver, ordering a medication test and procedure referring, and communicating with other healthcare professional when we are not reporting separately. It means that we are not billing for those services. It will be part of the CPTs. When we do not report clinical information or test results separately, we cannot bill for them with a separate CPT code. However, we still need to document this information in the health record and interrupt the test result independently. If we are not reporting the test result separately, we do not need to fill out the CPT code additionally. It is important to communicate the result to the patient, family, caregiver, or care coordination, but this communication is not reported separately. If physician or healthcare professional are slow in the typing and use the BPP method, means the hunt and pick method of typing, they need to track their work based on the time. They cannot do it, but it may not be the most efficient way of doing these things. According to the American Medical Association definition, this method is considered as a counting towards the time. However, it's worth considering whether there are better ways to use their time and you want to explore alternative method that could potentially save time and increase the productivity. Now let's talk about what does not count towards the time. When performing procedure, it is important to note that the time spent on them is reimbursed within the corresponding CPT codes. These include injections, biopsies, and minor surgeries, and filling out the form for things like tobacco sessions. Double dipping is not allowed. Additionally, travel time is not included in time component for E&M services. Finally, any teaching physician that is general and not specifically related to managing or particular patient is not counted toward the time component. As we refer to our CPT book, we can observe that the time component mentioned are not consistent across all services. For instance, for office visit and inpatient visit, a time range is provided, but still we can follow the MDM guidelines. That will be optional, because why not? There are some CPT codes are not based on the time. Some service like emergency department visit are coded based on the medical decision making, not based on the time, as the ED operates its own guidelines. So while something like inpatient subsequent visit or skilled nursing facility visit could be on time or medical decision making. And in our CPT book, we will see some services like critical care, prolonged services, or discharge code, which are purely based on the time component. Managing prolonged care can be quite challenging due to the different codes used for different locations, such as inpatient versus office visit. Medicare also has its own codes for prolonged care, which can add to complexity. In order to bill for prolonged care during an office visit, you must first meet the highest level of service, which is level 5. You cannot bill for the prolonged care based on the medical decision making for level 3 visit, and then add on prolonged care. Instead, you must meet level 5 service and then add on the time for prolonged care. However, billing for non-Medicare prolonged care is relatively easy because the AMA provides a crest in the CPT book that indicates that the time you need to meet in order to bill for the prolonged care course. These grades can be found with the prolonged care code set, not with the office visit code. For example, 99417 code is used for the office visit and the grade for billing prolonged care can be found under this code. With Medicaid office outpatient prolonged care codes are billed using G221 once the maximum time has been exceeded with another 15 minutes added on the top. For inpatient or observation services, G0316 is used for billing prolonged care once the maximum time has been exceeded with another 15 minutes until added to bill for that course. However, Medicaid time are little different because you have to surpass the maximum time by 15 minutes and they are billed in 15 minutes increment. So you can only bill for the prolonged care once you have hit 30 minutes. For example, say if you have 99223 represents 75 minutes, you can bill for the G0316 code once you have reached 105 minutes of prolonged care. For nursing facilities and skilled nursing facilities, you must also surpass the maximum time by 15 minutes and then have another 15 minutes until to bill for the code. In this case, the code G0317 is used if you have access to ENM grades that have the time component written on the EM. You can use them for reference. However, during the exam, you are only allowed to use your CPT book unless specified otherwise. The CPT book has the grade at the front and that provides an easier way for the medical decision making components and time. You can also add the prolonged care codes and their equivalent for the Medicare and note them under the prolonged care code. Now, finally, in conclusion, managing prolonged care can be tricky, but with a little bit of effort, it can be made easier. In the next video, we'll be starting some case studies. I hope you guys are enjoying this video. Thank you so much for watching my video.